Thank you. Well, as Oscar said, my work is about a proposal to use the intraoral images in order to try to identify missing persons. As we already know, dental comparison is one of the most recognized methods of identification. It's about by Interpol. But sometimes when we try to do the dental comparison, we have to face with the subjectivity, and it's based only on visual methods. In order to try to avoid this kind of subjectivity, we have, for example, the dental chart comparison. But in this case, we try to focus on the material that we have, we could use in order to try this comparison. In this case, we use the smiling photographs of the individuals as the antemortem, materials, because we could have accessibility to this kind of material. As already is told in this Congress, you could access to the social media photographs or also with the familiars, and you can have these smiling photos. Also, to the postmortem material, we're using the intraoral scan. It's now introducing in some autopsy rooms, and there are some cases in this superimposition method of intraorals and antemortem photographs are reported to be positively identified cases. For example, I guess in the Paris terrorism attack, there are some cases that was identified with this method. In general, the objective that we have in Panacea with the dental comparison is try to develop a robust method based on artificial intelligence, which includes automatic comparison using odontograms, as I mentioned before, segmentation and coding dental radiographs, and also superimposition and morphological comparison based on the radiographics and photographics, and CBCTs and intraoral, which is what we're discussing today. So what we are doing is exactly that, the superimposition between photographs and intraorals, and that includes a landmark set for the dental comparison that we could apply to the intraoral and to the photographs, test the variability in different scenarios, which means when we smile, we don't have the same smile. Sometimes you don't see the whole denture, so we have to take this in account. Let's discuss later, and develop a way to approaching the dental comparison through occlusal morphology. We already don't have the results of this part, but soon you will see. So now I'm going to expand a little more, because I'm going to explain you the set of landmarks. That doesn't work, sorry. The margin medial refers to the margin, the medial point in the margin between two teeth. The example is the 11 and the 21 based on the FGI numeric. Sorry. Thank you. Sorry. This refers to the occlusion. To the medial point in the collision of the two teeth. Sorry. The gingival, the gingival again refers to the gingival line where the two teeth encounters. But in this case, we have the X1, which refers to the 11 and the 21 gingival margin. In this case, we refer to the most upper position of the gingival arch of the tooth. The X1, X2 gingival is the same as I mentioned before, is the point in the gingival line where the two teeth encounter. Same with the X1, X2 medial margin. And we have the X1 distal occlusion, which means the most inferior point in the occlusal line in the distal margin of the incisors. These landmarks are applied to the first and the second incisors. The central occlusal is the middle point in the occlusal line of the incisor. And the mesial occlusal again, as the distal occlusal is the most inferior point in the occlusal line in the mesial margin. Here we have the same set of landmarks for the second incisor, the second and the third tooth, mesial margin, distal occlusal. In this case, we have to mark in the intraoral in the point where the tooth encounters, but in the photograph, this landmark is very different because we have to place it when we see that encounter in the photograph. Sometimes it could be anatomically correct, but sometimes we have to take in account the distortion. Again, the central occlusal. In the canines, we only mark the gingival margin and the cuspid. Is the most inferior point of the cuspid of the canine. Gingival, the margin. Again, with the premolar, we have the gingival, and the vocal cuspid is the same as the canine, is the most inferior point of the vocal cuspid. Now that we have described the landmark set, we have to describe the data set. In this case, we use a set of 50 frontal photographs of smiling subjects that we already have the intraoral models of the same patients in the same date that the photograph was taken. We mark all the landmarks with the skeleton ID software and do the superimposition with the processed algorithm. To try to prove the reliability of this method, we select 10 patients of that sample and do the marking of the landmarks by 4 anthropologists, including myself, with the same procedure than the dataset the original dataset. And what we have found that when we work with all landmarks described, we have a ranking of 1. What this means? We compare 1 intraoral front to the 15 patients, and in all the cases, the intraoral corresponds to the patient of the photograph. However, when we try to reduce the number of landmarks, reducing the first one, the gingival line, the results seems to be worse than the explained before. And we have to check at least 10 patients to get the correct patient to correspond to the intraoral model. If we keep reducing the landmark sets only to the occlusal line sets, we get the result that we have to check at least 11 patients to get the correct one. But finally, when we compare the results between all the experts, we have the same results that we get in the complete landmark set, in which all the patients correspond to the correct patient. With the results, we can conclude that the method seems to be very prospective, but we have to invest and have in account all the scenarios that we could have and try to improve the results when we don't have all the smiling photograph correctly and we don't see all the tooth. Thank you for your attention, and also thank you to the clinic of São João da Madeira who give us the data.